Millions of people are questioning whether they have ADHD. For some, this has been a life changing discovery. For others, there are concerns that normal human struggles are being too quickly turned into diagnosis. So, where does the truth sit between compassion and caution? My name's Rick Cardwell. I'm a psychodynamic counsellor and therapist, and this is a short video on the ADHD explosion. Now, there has been a huge rise in ADHD diagnosis over recent years, particularly amongst adults. Depending on who you ask, this is either long overdue recognition of a misunderstood condition or evidence that ordinary human struggles are increasingly being medicalised. The truth is probably more complicated than either extreme. As a therapist, I think it's important that we approach this conversation carefully, compassionately, and factually, because there are real people on all sides of this issue. Now, some people have spent decades struggling with genuine and debilitating symptoms that were repeatedly misunderstood. Others feel concerned that normal experiences like distraction, boredom, procrastination, emotional overwhelm, or difficulty concentrating are now too quickly being labelled as psychiatric disorders. Both perspectives deserve thoughtful consideration. One thing that is unquestionably true is that awareness of ADHD has exploded. Social media has played a major role in this. Platforms like TikTok, Instagram, YouTube and podcasts have introduced millions of people to information that previously felt inaccessible or heavily stigmatised. For some individuals, this has been life-changing in a positive way. Many adults, especially women with people with predominantly inattentive symptoms, were historically overlooked because they didn't fit the stereotypical image of the hyperactive little boy disrupting the classroom. Increased awareness has helped many people finally make sense of lifelong patterns of difficulty, shame, overwhelm, impulsivity, disorganisation and emotional dysregulation. And this matters. At the same time, social media has also dramatically changed how mental health is understood and discussed. We now live in a culture where short form content often reduces complex psychological conditions into highly relatable lists of traits and behaviours. Do you interrupt people? Do you struggle to focus sometimes? Do you start projects and not finish them? Do you lose your keys? Do you procrastinate? Do you get bored easily? The difficulty is that most human beings will relate to many of these experiences some of the time. Relatability is not the same thing as clinical diagnosis. A psychiatric diagnosis is supposed to involve more than recognising yourself in a list of symptoms. It should involve careful assessment of severity, duration, developmental history, impairment across settings, and exclusion of alternative explanations. This is where I think an important concern emerges. There is currently no definitive biological test for ADHD. There's no blood test, no brain scan, no objective biomarker that can reliably confirm the diagnosis. Diagnosis is still based largely on behavioural reporting, questionnaires, clinical interviews, developmental history and subjective interpretation. Look, this does not mean that ADHD is not real. Many legitimate medical and psychological conditions are diagnosed clinically rather than through laboratory testing. However, It does mean that diagnosis requires nuance, caution, and thorough assessment. And this is where many professionals are becoming increasingly concerned. In some settings, assessments are happening extremely quickly. People may complete online questionnaires, have relatively brief consultations, and receive diagnostic labels with limited exploration of other possible contributing factors. Symptoms associated with ADHD can overlap significantly with many other experiences and conditions: chronic stress, anxiety, trauma, sleep deprivation, depression, burnout, substance use, grief, excessive screen exposure, poor nutrition, relationship stress, overwork, even modern digital lifestyles themselves. We are living in an era of constant interruption, fragmented attention, endless notifications, reduced sleep, information overload, and increasingly high demand on cognitive performances. Many people today experience concentration difficulties and mental fatigue. That alone does not necessarily mean they have a neurodevelopmental disorder. Many people today experience concentration difficulties and mental fatigue, and that doesn't mean that there's something wrong neurodevelopmentally. I think one of the unintended consequences of social media mental health culture is that it sometimes encourages people to interpret distress through a single framework before exploring the broader picture. Algorithms also reward certainty and identification. Nuanced content rarely goes viral. Short, emotionally validating content does. Saying you may want to explore this carefully with a qualified professional who considers multiple explanations does not spread as quickly as if you do these 5 things, you probably have ADHD. And once people strongly identify with a diagnosis, it can become emotionally difficult to question it. Look, this does not mean that people are intentionally exaggerating problems. Most people are genuinely trying to understand themselves. But humans naturally seek explanations that feel emotionally coherent and validating. There is also an important social component to diagnosis that we should acknowledge very, very honestly. Receiving a diagnosis can provide relief. Language, validation, self-understanding, workplace accommodations, academic support, and access to medication, and a sense of belonging. For many people, it genuinely changes their lives for the better. But whatever a diagnosis also carries social meaning, identity, communication, practical advantages, there's also potential for over-identification or over-expansion of diagnostic categories. Again, it doesn't mean that ADHD is fake. It means human psychology and social systems are complicated. I also think we need to be careful not to move into another extreme, dismissing or mocking people seeking help. There has been a growing backlash online where some people argue ADHD is simply laziness, lack of discipline, bad parenting, or social contagion. That position is not supported by evidence either. ADHD has decades of research behind it. For many individuals, symptoms are severe, impairing, persistent, and life-altering. Difficulties with executive functioning, impulsivity, attention regulation, and emotional regulation can profoundly affect education, employment, relationships, finances, and self-worth. So this conversation should not become ADHD is real versus ADHD is fake. That framing is far too simplistic. The more important questions are we assessing people thoroughly enough? Are we distinguishing between pathology and normal human variation carefully enough? Are social media platforms distorting public understanding of mental health? Are some people being missed while others are being labelled too quickly? And are we allowing enough room for complexity? Because psychological assessment is very rarely black and white. Human beings are complicated. Attention is complicated. Personality is complicated. Trauma is complicated. Modern life is complicated. Good mental health care should leave room for uncertainty, curiosity, and nuance. As therapists and clinicians, I think we have a responsibility to resist both dismissal and over-pathologising. Not every struggle requires a diagnosis, but genuine suffering also deserves to be taken seriously. Sometimes a person truly has ADHD. Sometimes anxiety or trauma is driving concentration difficulties. Sometimes chronic stress and burnout are overwhelming cognitive capacity. Sometimes poor sleep, excessive technology use, or environmental factors are major contributors. Sometimes several things are happening at once, but the goal should not be to rush towards labels. The goal should be understanding. And perhaps this is the most important point of all. A diagnosis should ideally help a person understand themselves more deeply, not reduce their identity to a category. Mental health conversations are becoming increasingly public, fast-moving, and emotionally charged. Social media has helped many people feel less alone, but it has also encouraged oversimplification of highly complex psychological realities. So maybe the healthiest position is one that combines openness with critical thinking. Take people seriously, avoid mockery and stigma, recognise that ADHD is real and impairing for many individuals, but also acknowledge that there are legitimate concerns about self-diagnosis, social contagion, and commercial incentives, rapid assessments, and the increasing tendency to medicalise ordinary human difficulties. We don't need to choose between compassion and scepticism. Good clinical thinking requires both. So thanks for watching the video. It's a little bit lengthy, but I just wanted to get across lots of points that I've read and tried to understand for myself. And working as a therapist, these are things that we have to work through every single day. So if you struggle with your mental health, if you want to call, contact me for a chat, a call to find out what's going on for you. We can have a free confidential chat. I can give you advice and guidance. Or if you go into professional work, that's absolutely fine as well. So thank you for watching the video. Please like, share, subscribe, whatever these things do that help this to reach more people. And I'll be back with another video soon. Thanks for watching.